Hello friends, let us discuss with the diseases of the cornea today in this ophthalmology playlist. So first the usually asked question is, what are the organisms which can penetrate the intact corneal epithelium? Usually the bacteria are the bacteria which have this Listionella, Cornybacterium and gonococcal bacteria like gonococcal Neisseria gonococci and Neisseria meningitidis like bacteria. These are the usually bacteria. They cause penetration within the intact cornea. Even though your cornea is not traumatized, it is not been with any kind of aberration. Even after that, the bacteria start penetrating within your cornea and cause your ocular infection. So at this time, so it is called as penetrative corneal epithelial infection by the bacterium. Okay, so what are the bacteria that usually cause this penetrating infection within an intact cornea? These are the bacteria like Cornybacterium diphtheria and Neisseria species, especially Neisseria gonococci and Neisseria meningitidis. This Neisseria meningitidis further will cause your meningitis. So there is one bacteria called as Pseudomonas aeruginosa bacteria. This bacteria will cause infection within the cornea whenever the cornea is abrated or it get damaged. Okay, at that time the Pseudomonas is one of the bacteria that will cause the infection to the cornea, leading to keratitis. Now next comes the Hypopion. What is Hypopion? So Hypopion corneal ulcer. Hypopion corneal ulcer. Hypopion refers to accumulation of excessive WBCs within your anterior chamber. Okay, within this figure you can see what is an anterior chamber, and you can see also the type of the Hypopion, how the Hypopion usually look like. So Hypopion refers to accumulation of excessive WBCs, neutral and inflammatory cells within the anterior chamber. Why it is caused? It is usually caused because of the inflammation of the cornea. Okay, it is usually caused because of the inflammation of the cornea. As a result of the corneal inflammation and even the conjunctival inflammation, secondary to the conjunctival inflammation, or even the choroid inflammation, or even the uval tract inflammation, okay, and even the scleritis inflammation, okay, whenever even anterior within the eye, whenever there is the foreign body enlargement, at even that time, okay, WBC start accumulating within the anterior chamber, and this excessive cell debris of WBC within the anterior chamber, it leads to Hypopion, and this condition it is called Hypopion. How will you treat this Hypopion? By extracting the cellular debris. WBC cellular debris will be extracted. Okay, by doing extraction of the cell debris, you can treat this thing. Extraction may be therapeutic use always, and even a diagnosable use as well. Okay, to stop the infiltration and even to stop the inflammation further, the prednisolone, the anti-inflammatory steroidal anti-inflammatory drugs or the eye drops are usually used. And to treat the underlying any bacterial infection or even the fungal infection, the antifungal and antibacterial eye drops or ointments are used. Okay. So next comes is, what is fungal keratitis, or it is also called as keratomycosis. The fungal keratitis or the keratomycosis, it is a fungal infection of your cornea. Whenever the cornea get damaged because of any thorn, especially the tree thorn, or any by dusts, or the spores get lodged over your cornea during a fast wind blow. Okay, at that time, whenever the cornea get infected by fungus, especially candida or fumilative bacteria fungus, or even aspergillus, okay, this bacteria will lead to fungal keratitis, inflammation of the fungus. They cause inflammation of the fungus. And how do we treat with this? Again, the same antifungal drugs in the pharmacology we have studied about ketoconazole, fluconazole, nystatin, eye ointment are available, eye drops are available, along with the prednisolone, dexamethasone, anti-inflammatory drug. We treat the fungal keratitis. Okay. So next comes is the non-healing corneal ulcer. What are non-healing corneal ulcers then? So some of the ulcers of the cornea. Ulcers refers to erosion of the cornea tissue layers or the cell layers. So it's called as corneal ulcers. Whenever there is ulceration of the eye and the basic cause, the underlying cause is not known. The exact whether it is even the physician is unable to see any bacterial infection, any kind of fungal infection isn't there, and only inflammatory cells are getting into the cornea and damaging the cornea and causing the scar of the cornea, leading to its damage, leading to its ulceration. That is called as a non-healing corneal ulcer. The basic cause is not known. Basically, it would be a Marfan syndrome, autoimmune disorder where the connective tissue get damaged the connective tissue of the cornea getting damaged, okay, or it may be any rheumatoid disease that is causing the damage to the cornea, that would be there. The basic treatment is again methotrexate. Immunosuppressant drugs is usually used, such as methotrexate is used. Even the corticosteroids like prednisolone is used. Dexamethasone can be used in the form of ointment, in the form of eye drops. Okay, there is no stoppage for the ulceration. So, and basic cause for this ulceration is not known. Only the keratoplasty will be the ultimate treatment. What is keratoplasty? That is transplant of the cornea is called keratoplasty. Only that after a complete transplant of this thing is the only will be the treatment, last choice treatment during the non-healing corneal ulcer when it is not controlled. So next comes is the basically asked question is factors for responsible for corneal transparency. Why the cornea is transparent, and what are the factors for transparency, the transparency of the cornea? You can see in the picture the cornea. Okay, why it is transparent? Why it is capable of permitting the light towards through it? Because of the lamellar arrangement or the uniform arrangement of the epithelial cell. The cornea is made up of epithelial cells. Okay, so there is uniform arrangement of the epithelial cells, lamellar arrangement, and even the collagen fibers within this is very thin compared to any other part of the body's connective tissue. The collagen fibers within the cornea is very thin, and because of this the refractive index of the cells as well as the collagen, the intracellular matrix resembles same. Okay, they get summed up. Okay, they get evenly or they get equivalent. Because of that the light can penetrate without any kind of opacity. The opacity is not found, and the cornea become transparent. And even the thinness of the cornea is a main factor for the corneal transparency, and even the dehydration. The cornea is usually dehydrated. Okay, it is a dehydrated structure, and because of that, and even the avascularity of the cornea leads to its transparency. So these are the main factor why the cornea is transparent. So next comes to the dendritic ulcer. Dendritic ulcer, it is a common viral infection of the cornea. Whenever the herpes simplex virus get inoculated within your eyes, whenever you get shingles, that is herpes infection, you get ulcer over your cornea. The virus start depleting your corneal epithelial cell, and because of this the cornea get ulcerated. This is called as dendritic ulcer. Then how do you treat it? You will be treating this with antiviral drug like oral acyclovir is given, or acyclovir is the usual choice of the drug which is used to treat the viral disease, and even with the combination of the steroid, anti-inflammatory steroid like dexamethasone is also been given to stop the inflammation during the keratitis. So usually this herpes infection will overall, if it is not controlled in the well time, it will be leading to the scarring of the cornea, and that lead to the corneal opacity. What is that thing? We will be discussing within this video only. Okay, next term is the acanthamoeba keratitis. The keratitis term refers to corneal ulceration, friends. Okay, you have to remember what is keratitis. There are different causes of the keratitis that we are discussing. The keratitis is the inflammation, the scarring leads to damage of the cornea, leads to the vision problem, blurring of the vision, redness of the cornea, or the complete opacity of the cornea. It is called as keratitis. Keratitis, inflammation of the cornea is keratitis. Okay, what is now acanthamoeba keratitis? Acanthamoeba keratitis refers to the acanthamoeba. The basic cause for the keratitis is acanthamoeba. Then what is this acanthamoeba? It is a kind of protozoa. Okay, like you have seen the Antamoeba histolytica, the same way it is an protozoa which lodges within the water and make the eye infected. It is usually common within the contact lenses wearers. Okay, wherein with the people wear contaminated lens. Whenever they wash the lens with the tap water or contaminated water, the protozoa get lodged within the cornea, and because of this it starts spoiling the cornea, resulting in acanthamoeba keratitis. So how will you treat? Again, the anti-inflammatory will be the first choice, and it is a very dangerous disease, friends. Why? Acanthamoeba keratitis may lead to meningitis, may go to the central nervous system, it may penetrate within your eye, it runs to the optic nerve, then it goes to the central nervous system and causing meningitis as well, damaging your central nervous system as well. So it is very important to treat, to control this acanthamoeba keratitis immediately, to stop the entire systemic infection. Okay, it is usually seen in the contact virus. So how will you treat? Usually antiseptic, cimetidine like antiseptic is used to treat this kind of infection. So and even the anti-inflammatory is used, anti-protozoal ointment. So ointment like anti-protozoal ointment are used to treat the acanthamoeba keratitis. So next comes is what is peripheral ulcerative keratitis, PUK. It is abbreviated as PUK, peripheral ulcerative keratitis. Peripheral ulcerative keratitis refers to keratitis of the cornea, the inflammation of the cornea only on the peripheral. Okay, it may include the sclera, that is scleritis. Okay, it is usually a immune disorder wherein which the immune system reacts with the collagen fibers of the cornea as well as the sclera, leading to the damage. So together they will be called as peripheral ulcerative keratitis, and only the peripheral part of the cornea is depleted, bearing the interior part. And how will you treat this thing? As it is a rheumatoid reaction or autoimmune reaction, we will be treating with the methotrexate. Usually the basic choice will be methotrexate, immunosuppressant drugs. Okay, it depends on the physician and even the new researchers which will be the effective, but the basic immunosuppressant will be the methotrexate. Now comes is the corneal edema. What is corneal edema? So corneal edema refers to the edema of the cornea. Edema, what is edema? Increase in intracellular fluid content excessively or abnormally. It is called as edema. It is a part of inflammation. Now, why inflammation causes? It may be caused because of physical injury. It may be caused because of biological injury like any infection from fungus, viruses, bacteria, protozoa, or it may be caused due to chemical like burns, ammonia sulfate, or any acid attack is there, or it may be physical, as I told you, physical. It may be because of radiation, UV light, or it may be because of the trauma, because of any kind of pollens or anything that irritates your corneal epithelial cells and makes them irritated, inflamed, and because of that there is inflammatory action leading to the accumulation of the excessive fluid within the corneal intracellular space, tissue intracellular space. This is called as corneal edema. So how will you treat? You will be treating it with a very simple treatment. Use just a hypertonic solution, that is normal saline, 2% or 5% eye drops are available to treat this corneal edema. This can be very simply, it can be treated by using normal saline, hypertonic saline. Okay, this removes the corneal edema, installation of the what you call normal saline. Next comes with the corneal opacity. So as I discussed before, the keratitis, any kind of keratitis, whether it is a bacterial keratitis, traumal keratitis, or any thing which cause keratitis, inflammation of the eye, and because of the bacteria such as Trichomonas, especially bacteria, or even the syphilis, during the syphilis, whenever the cornea get upset because of cornea get insulted because of the bacterial inoculation, and because that get inoculated and the scar remains, the scar of the cornea appear opaque. Okay, that doesn't permit the light to enter through that, and because of that there will be a vision problem, sensitivity towards light will be there. Okay, the person goes blind sometime when the scar is not treated. How will you treat? By using keratoplasty. What is that? We'll be discussing in the later things. Okay, so corneal opacity is the impermeability of the cornea to transmit the light, is called corneal opacity. It may be because of any bacterial infection, or it may be physical trauma, or it may be a chemical trauma. Okay, any acid or any alkalis will be there that caused any kind of damage towards your eye, towards the cornea, that will be leading to the scarring. And if it is not treated, because the scarring may develop, even if the etiologic agent is removed, the scar develops is the furthermore. Okay, and it leads to opacity of the cornea, and it will be caused corneal opacity. Then what is corneal scar? As I discussed before, any insult or any kind of any kind of infection that degeneration of the corneal tissues will lead to scarring. As a scarring over your body could be seen anywhere after a trauma. You can see a scarring, collagen get deposited, and the tissue mark can be seen. Okay, cut mark can be seen. That is called as scarring. Then scarring is there when it is not healed, when it is not controlled. That leads to corneal scar, and development of that corneal scar to corneal opacity, and that leads to blindness or the complete vision disorientation, or the vision sensitivity of the light is lost. Now, what is Moran's ulcer? Moran's ulcer refers to, it is a kind of peripheral ulcerative keratitis only, but here only the cornea is involved and the sclera is bare. Only the corneal collagen get affected by the autoimmune antibodies. It is also abbreviated by MU, Moran's ulcer. Moran's ulcer refers to inflammation of the cornea just because of the autoimmune reaction towards the collagen, the collagen of the cornea. The autoimmune antibodies are attacking the collagens of the cornea, and because of that the keratitis result, and this keratitis is called as Moran's ulcer. Okay, Moran's ulcer result in keratitis. Okay, that keratitis is mainly because of the Moran's ulcer. Now, what is keratoconus? the keratoconus, it is basically the cause is very much unknown, but usually they tell it is excessive rubbing or any physical trauma or using of the contact lenses. Okay, this lead to keratoconus. What is keratoconus? The name itself indicates. Kerato means the cornea. The conus means cone shape. The cornea is usually curve shape. Whenever keratoconus occurs, it becomes a cone shape, and because of this, the person may go blind in the later stages, but he usually get blurred visions. He usually start getting the blurred vision because the light rays are not focused over the lens properly in the keratoconus condition. The cause of keratoconus is basically unknown. What next comes is the keratoplasty. The last few things I'm going to do is the keratoplasty. Keratoplasty refers to the transplant of the cornea tissue, whether it is a partly scarred tissue is removed and that is being replaced by another donor person. Okay, because the cornea is avascular first of all, and it is more immunopotent. It is not targeted by the host or the recipient immune system, so it is most widely practiced grafting practice within the surgeons. So keratoplasty is the plastic grafting of the corneal tissue over the damaged by after removing the damaged corneal tissue from the deceased person. It is called as keratoplasty. When it is indicated, it is usually indicated within the person who have got the keratitis, extreme keratitis, ulcerative keratitis, like any infection is there, trauma is there, chemical burns are there, physical trauma is there. So any kind of thing has happened because of which the cornea has been completely damaged, autoimmune reaction has been happened, and the complete damage has happened to the cornea. Now the cornea has to be replaced, and there is no other choice for the ophthalmologist at that time. So something the keratoplasty is a surgery wherein which some donor, the recipient has been donated by the cornea of the donor who is dead or he is maybe alive, depends on the donor. Okay, now next comes is the penetrating keratoplasty. Penetrating keratoplasty is nothing but the keratoplasty wherein which entire cornea get replaced by host donor's cornea. It is called as penetrating keratoplasty. The entire cornea, the circular incision is made by using a trephine. Trephine is a kind of surgical instrument, made usually a cylindrical instrument which has saw teeth on its one end, and it makes a circular incision. And because of this thing, it is of a very diameter. It can also be used for the skull surgeries and even the cornea surgeries. It is usually used to use circular incision is made and entire cornea is removed from the deceased person who has this keratitis or any kind of inflammation wherein which the cornea has completely been damaged, and then it will be replaced by the donor's cornea. So it is called as penetrating keratoplasty. Okay, again the indication are same as that of the keratoplasty. So this was all about the diseases and the treatment regimens involved in the diseases of the cornea. Okay, so thank you for watching my video. Please like and subscribe to my channel and keep watching my videos. Thank you. Bye, and stay healthy, stay fit.